Thank you for joining today. My name is Paul Stevenson, CEO of Conform Compliance. Conform Compliance is the sponsor for today's presentation. What we wanted to do was introduce Conform Compliance to you, introduce our skills and services from a perspective of giving you a glimpse at what we see as the core of a solid healthcare compliance program. Briefly, before I introduce Linda Howard, who will be our main speaker, I'll introduce myself. As I said, I'm Paul Stevenson, CEO of Conform Compliance. Prior to starting Conform, I was an executive at Amerigroup Corporation, managing Medicare and Medicaid sales and marketing operations. As you'll learn later today, Amerigroup was under a corporate integrity agreement, and as a result was really a trailblazer in compliance in the last 5 years. It was then when I started to work with Linda Howard, the compliance officer for sales and marketing at Amerigroup. And she oversaw compliance for about 15 different markets, very diverse markets, ranging from Albuquerque, New Mexico to New York. And we were overseen collectively because the team was under this corporate integrity agreement by special compliance auditors who were reporting directly to the Office of Inspector General. So it was in that crucible that we developed the skills and the knowledge of the patterns that we've incorporated into Conform Compliance, the software application. I'll talk more about Conform later on at the end, but now I'd like to introduce Linda Howard, who, as I had mentioned, was a compliance officer at Amerigroup and is now our compliance officer at Conform. And in addition to working with Conform, Linda is CEO of Alturnative.
Hi, thanks, Paul. I'm Linda Howard, and as Paul mentioned, we have some history together at Amerigroup, so I'm very happy to be on this team with Conform and to talk to you today. And the title of the presentation today is From Policy to Practice, Medicare Marketing and HIPAA Basics. Don't gamble with compliance. Conform. So what we're going to talk about today are some of the high-risk areas, the rules and penalties, HIPAA, the basics, and some tips for instantly improving your practices, a little bit about Medicare marketing, basics, and tips for instantly improving your Medicare marketing practices. And you'll find here that we will be talking specifically about Medicare marketing, but a lot of the principles that we're raising for Medicare marketing will also apply to Medicaid, pharmacy marketing, but just to give you a sense of what some of the issues that you may need to be concerned about, but we're capturing it all underneath Medicare marketing. And also some options for controls, which are some compliance tools and resources. So how confident are you that you're protecting your company, your leadership, your team, and yourself? I want you to think about that answer now, and then as we go through the presentation, I want you to ask yourself that question again and see whether or not your confidence level has changed at all. So, our high-risk areas and penalties and high-risk areas and penalty activities on your radar. There are 4 areas that I focused on as high-risk areas based on my experience having worked in the healthcare industry, particularly on the compliance and the regulatory side, and also doing some operations are anti-kickback under marketing, discrimination under marketing, privacy, the HIPAA and state privacy laws, and HIPAA security, and that also includes HIPAA and state laws around security breaches. So, let's talk a little bit about some of the penalties associated with some of these high-risk areas. The civil federal privacy violation penalties and liabilities. The Department of Health and Human Services may impose civil monetary penalties on a covered entity of $100 to $50,000 per failure to comply with a privacy rule, not to exceed $1.5 million per calendar year for multiple violations of the same privacy rule. And you'll see I have a little chart over here, a little diagram over here on the side. And this is to kind of indicate to you how you can easily rack up penalties underneath HIPAA. And the limitation of $1.5 million per calendar year is per rule. And sometimes a single activity can violate both a privacy rule and a security rule, resulting in penalties as high as $3 million in a calendar year. The Department of Health and Human Services, Office of Civil Rights, received and investigated over 90,000 HIPAA complaints since 2003. This diagram here is to just give you some indication of some of the larger verdicts, because a lot of times when I talk about HIPAA and I talk about these million-dollar verdicts, people wonder, is that really possible? Does that really happen? So I pulled out a few cases for you where we had Signet who had a penalty of $4.3 million for violations of HIPAA. And this violation was not a privacy violation. This was related to access to records. Under HIPAA, patients and members are entitled to their records if they request them. And because Signet failed to supply 41 members with their records, they received a penalty of $4.3 million. We've also had some cases that totaled, three cases totaled up to $4.2 million relating to lost or stolen laptops or SUV drives. And one of the interesting ones was Alaska, because Alaska involved actually the Department of Health and Human Services. So it was the Department of Health and Human Services that actually violated HIPAA and received penalties. CVS and Rite Aid, collectively they paid $3.25 million. And this was for disposing of prescription bottles and the paper that go on prescription bottles in a way not to protect that health information. So they were thrown out without shredding the information. We have situations where updates to a web-based application or portal was involved. This was WellPoint. And this was an instance where WellPoint didn't limit access to that database. That was a $1.7 million. And this one actually surprised me, which was Affinity. And this was they returned copy machines to a leasing company with the data still on the copy machines. And this was a $1.2 million verdict. And this is just some of the larger cases, but there are so many different HIPAA cases out there, and oftentimes we don't understand what the risk is. So when I talk about gambling with compliance, it's a big gamble. This next slide is designed to really point out the value of cooperation. I talked about the Signet Health case. This was Signet Health of Prince George's County, whose penalty was $4.3 million for denying 41 patients access to their medical records. Well, $1.3 million was for the violation, but $3 million of it was for failure to cooperate in the investigation. When the agency requested information, Signet did not comply with the request in a timely fashion. And so there was an additional $3 million added to that penalty for its failure to cooperate. Now look at Providence, who had a breach of 386,000 patients, and their penalty was only $100,000. And the agency pointed out that because of their cooperation, their penalty was only $100,000. So this is a demonstration of how it's not just whether the breach, but it's also how you respond to the regulators during the investigation process, which is why Conform becomes, or platforms like Conform become so valuable, because what you want to be able to do is you want to be able to retrieve information in a timely fashion should you be audited or the subject of an investigation. Now, the next slide actually talks about some of the criminal penalties, and this slide usually gets people's attention when I talk about the criminal penalties, because with the civil penalties, we're talking about dollars, and this does impact the company's bottom line. But when you start talking about criminal penalties, you're actually talking about potential jail time. And what I want you to remember is that companies do not go to jail. The individuals that cause the violation go to jail, which sometimes can mean the executives. So underneath HIPAA, a person who knowingly obtains or discloses individually identifiable health information in violation of privacy may face a criminal penalty of $50,000 and up to 1 year imprisonment. The criminal penalties increase to $100,000 and up to 5 years imprisonment if that wrongful conduct involves false pretenses. And it increases further to $250,000 and up to 10 years imprisonment if the wrongful conduct involves the intent to sell, transfer, or use identifiable health information for commercial advantage, personal gain, or malicious harm. And again, people might ask, does this ever happen? There are not a lot of criminal cases, but there are some criminal cases, and we pulled a couple of criminal cases just to give you an example. Ms. Smith collected patient information to help her husband with an impending lawsuit. She was sentenced to probation and community service and expired her license as an LPN. So she was penalizing for wrongfully disclosing a patient's health information for personal gain, which put it in the category of a criminal violation. The next case, this individual was sentenced to 4 months imprisonment for reading medical records of his supervisor and high-profile celebrities. Again, a case where this case actually involved jail time. The other time there was probation. We talk about privacy a lot of times in the healthcare industry. We think about HIPAA, the federal rules, but there are also state laws that we have to be concerned about. There are 46 states, the District of Columbia, Guam, Puerto Rico, and the Virgin Islands that have enacted legislation requiring persons or entities doing business in these respective states to notify individuals of security breaches involving personal information. And these security breaches do not necessarily mean health information. This is involving personal information. Most states also have privacy laws prohibiting violations of a person's privacy rights. Many states have laws protecting medical records. So in addition to your HIPAA laws, you also have medical record laws. And again, criminal penalties may be imposed under state law if the information was used for some criminal activity. Typically, it's things like identity theft. The next high-risk area is the anti-kickback statute. I don't know if we have individuals on the call from the provider side from hospitals, but usually in a hospital setting, people are quite familiar with the anti-kickback statute. But the anti-kickback statute can come into play also with regard to marketing activity. So this could impact also managed care organizations. It could impact pharmaceutical companies that have reps out there that are marketing drugs. And the anti-kickback statute says that anyone who knowingly and willingly receives or pays anything of value to influence the referral of federal health care program business can be held accountable for a felony. in any arrangement where one purpose of the remuneration was to receive or give payment for the referral of healthcare program business or to induce referrals is a violation of the anti-kickback statute. And let's look at the penalties here. Again, this is involving jail time, and I'll give a little anecdotal story here. When I first joined Amerigroup and I gave a presentation to the marketing team and I talked about the anti-kickback statute and what reps could and could not do, I got a lot of looks on the face like, are you sure we can't do that? When I started talking about prison time and that the individual themselves can go to prison, it was amazing the number of things that the marketing team ran past me to make sure it was not a violation of the anti-kickback statute. Things like if we bring a lunch to the staff at a provider's office, is that considered a violation of the anti-kickback statute? Because the penalties here could be up to 5 years imprisonment plus a criminal fine of $25,000. There can be administrative civil penalties of up to $50,000. And there can also involve exclusion from participating in any federal health care program. Now, if you're lucky, you don't get excluded as a company from participating in federal health care programs, because for a lot of companies that would mean going out of business if that's what you do, if that's where the bulk of your revenue comes from. So if you're lucky, you get subjected to a corporate integrity agreement. And a corporate integrity agreement can be a very expensive process to be underneath a corporate integrity agreement, because there are a lot of things that you're required to do that you would not normally be required to do in your normal course of business, such as hiring an independent review organization and to do a number of reviews, and those bills can run up quite quickly. The other area is discrimination. Federal laws protect individuals from discrimination due to their race, ethnicity, national origin, religion, sex, mental or physical disability, sexual orientation, genetic information, or source of payment. Managed care organizations that discriminate against potential enrollees may be liable for violations of the False Claim Act for collecting payment from a government health care program for services that were not rendered as contracted. And I'm not going to get into a lot of detail about the False Claim Act, but just to give you some indication of what the penalties are underneath the False Claim Act. You can be fined up to $11,000 per false claim, which means that can be $11,000 per member per month where the violation was occurring, and that bill can rack up pretty quickly. There's also trouble damages, so it's not enough that that $11,000 is multiplied by some creative math per member per month, but then that amount can be tripled. And plus, the entity can be excluded from participating in federal health care programs, and generally the executives involved in a company are also excluded as individuals from participating in federal health care programs. Again, if you're lucky, you don't get excluded and you get underneath a corporate integrity agreement. And that brings us to the Amerigroup case. In 2006, Amerigroup was found liable for $334 million based upon the allegation that Amerigroup intentionally refused to enroll pregnant women in its Medicaid health plan in Chicago. The jury awarded $48 million in single damages, which was trebled to $144 million. They found that Amerigroup had submitted more than 18,000 false claims for payment. As a result, the court awarded $190 million in penalties for a total judgment of $334 million. Amerigroup appealed this judgment, and then they later settled without any admission of guilt, but they settled for $225 million. And this allowed them to avoid any potential of exclusion from participating in any government health care program. Plus, they were underneath a 5-year corporate integrity agreement which is, if my math is correct, I think that they probably will be coming out of that corporate integrity agreement, or they just came out of it in January. And the whistleblower received $56.25 million. And I put this in there because it's important for companies to understand that there's a great incentive for employees to report any suspicions of wrongdoing as it relates to the False Claim Act and discrimination, which could bring it underneath the False Claim Act. So in this case, Amerigroup agreed to settle in order to avoid even the potential of exclusion, even though there was no admission of guilt. So this is a case where Amerigroup may not have even been responsible for discrimination, yet they settled for $225 million. Okay. So those are the high-risk areas. And so I want you to think about the question that I asked you earlier on. How confident are you that you can protect yourself, your company, and your staff when it comes to compliance issues? And we just talked about some of the high-risk areas and some of the big verdicts. But there are a lot of small verdicts and there are a lot of lower risk areas. Okay. Now this brings us to our discussion of HIPAA. Most of you on the phone are probably quite familiar with HIPAA, but HIPAA pretty much requires individuals and entities to comply with some very prescriptive and rigorous privacy rules. And when we talk about the HIPAA basics, when we provide training, HIPAA training as consultants, when we provide HIPAA training, we go in detail into all of the HIPAA rules. But here, these are just a high level of some of the basics that you're required to have business associate agreements with anyone that is defined as a business associate of yours if you are a covered entity underneath HIPAA. The minimum necessary rule is a rule sometimes that's difficult for companies to comply with. They don't focus on this rule, but it basically means that there has to be the minimum amount of access to information as possible and the minimum amount of information about an individual has to be released when providing information. So this is requiring a company to take steps to minimize access and to minimize the amount of information that is released. Authorized use. Information can only be used for authorized use, which means that using information for marketing purposes can sometimes be a violation of HIPAA because that was not the authorized use of that information. Companies are required to protect data, that's electronic data, and they're required to secure papers in a way to avoid unauthorized disclosures. Members and patients are entitled to notices of breach underneath certain circumstances. They're entitled to receive a notice of privacy outlining their privacy rights, and they're also entitled to have access to their records, as we've seen in the Signet case with that $4.3 million verdict. And they're entitled to say who is authorized to have access to their records. And so there has to be a process in place of making sure you have proper authorizations for release of information. Okay, so let's keep moving because we're definitely want to respect your time and talk about some of the tips for improving your privacy practices. Okay, and our full presentation in our training, we go over 10 different tips. One is around policies and procedures, privacy notices, employee badges, how to deal with external parties and business associates, training and discipline of staff, electronic communication, computer use, verbal and telephonic communication, storing and securing paper files, and how to properly dispose of files. I'm going to go over just a few of them for purposes of this presentation. And if anyone's interested in information on full presentation, you can contact us after this. Policies and procedures. You want to make sure you establish policies and procedures to protect information. And your policy should require that clients grant permission prior to disclosure, that your policies and procedures need to be reviewed and updated annually. They must be disseminated to employees and accessible to employees, and they should outline disciplinary process for employees who violate privacy policies. Tip number 4 is the external parties and business associates. The subcontractors hired to provide services, whether it be healthcare services or administrative services, should comply with your privacy policies and all relevant regulations and contract provisions by which you are bound. And you should also make sure that they are subject to audits for compliance. And if they're defined as a business associate, you are going to be required to make sure you have an agreement that requires these things. You need to have them sign a business associate agreement prior to disclosing PHI. Protected health information require that HIPAA training and you need to receive certification that that training has occurred, and establish a process for oversight. My tip number 5, it relates to training and discipline. You want to train your staff and create a culture that communicates to your employees a zero tolerance for non-compliance. This is not about being mostly compliant. This is a zero tolerance for non-compliance. Provide privacy training to new staff and annual refresher training to existing staff. Allow only authorized employees who are trained in the proper handling of information to have access to it, and employees who violate the privacy policy should be subject to a disciplinary process. Tip number 6, these are just, there's a lot of information around electronic communications. There's a whole section of HIPAA relating to security laws, but I'm just going to touch on a few simple things, which is handling emails. Only the minimum amount of information necessary should be included in an email. And if possible, you want to de-identify the information, meaning remove any unnecessary information. If it's not necessary to have the member or the patient's name, remove it. If the social security number is not critical to the communication, remove it. Emails being sent to multiple recipients should be done in a manner in which the recipient's names are hidden. So you want to consider using blind carbon copies. If you're sending out communication to a number of members or patients, make sure they can't see each other's names. An email should always be encrypted before sending, and I'm placing faxing underneath the electronic communications. And with faxes, oftentimes people's numbers change, so prior to faxing something, you want to confirm the fax number before faxing. And if there's a frequent number, you might want to store that number so it's less chances of misdialing. Tip number 7, computer use. Avoid unwelcome eyes on your computers. Simple thing, face computers away from the public or the views of other employees. If that's not possible, like situations like a cubicle environment, purchase privacy screens for your team. Lock computers that's not in use, and you should use software that allows different levels of permissions in client access. So not all employees should have all access. They should only have access to the records that they need to have access to. And deactivate employees' computers login after they terminate. There should be a process in place that if someone leaves that company, that they are immediately deactivated, not a week later, but immediately. Okay. So now this brings us to our marketing practices. How confident are you that your marketing practices are compliant? I'm not going to go in detail on all of the rules, but I wanted to put some rules up just to kind of frame the discussion, that there are a lot of rules in marketing, and these are rules that we need to be aware of and making sure that we're complying with each and every one of these rules. Like for instance, Medicare Advantage organizations are required to only use agents, brokers, and sales representatives who are licensed, certified, or registered under state law. So you want to make sure all of your agents are licensed. And in the event of misconduct, you're required to actually to report that. A lot of times that report goes to the state insurance Department of Insurance. So you want to make sure that misconduct is also captured and that you're keeping records of that. Are you following agent appointments? Agents have to be appointed who are selling Medicare. So you want to make sure that you're checking, that you're following up on state appointments, that you're confirming that new hires have completed all of their testing before you appoint them, and notify your agents if there's any denial of their appointment, and also making sure that agents do not sell on behalf of your plan until they're appointed. There are a lot of key marketing requirements that need to be reinforced, and we're not going to go into detail, but there are requirements around marketing materials, agent behaviors, what kind of giveaways are allowed and underneath what circumstances. And all of this, making sure that this is occurring, is all around monitoring. Now, the consequences of noncompliance can be a warning and notice of noncompliance. It can be monetary fines and penalties. It can be suspension of marketing and enrollment activity. It could also be exclusion from participating in government programs. It could trigger an audit, and it can cause reputational harm. Now, this next screen, I just wanted to give you a quick screen of what Conform looks like for tracking training. This is a screen that indicates a particular rep, showing that the rep took a refresher training course, the effective date, and the expiration date when that rep needs to receive the refresher training. And all of this you can run reports on, and Paul, when he talks to you, he'll give you some more detail on what Conform can do. The other thing that I'd like to point out is that a lot of companies have compliance plans, but if you're engaging in marketing activity, I suggest that you have a specific marketing compliance plan that requires you to have training, oversight and monitoring, corrective actions, what policies and procedures you need, information relating to your hotline, how you handle corrective actions, and how you respond to agent misconduct. So here are our 10 tips for marketing compliance. Tip one is around anti-kickback. 2, non-discrimination. 3 is the monitoring of sales and marketing activity. 4 is monitoring and tracking of agent appointment and licensing. And 5 is relating to documentation, having solid documentation. And if you're selling Medicare products, it's tip number 6 is related to scope of appointments. 7, applications. Number 8, being on the CMS calendar. Number 9 is around cold calling, and number 10 is around meals. And again, I'm going to go through a couple of these real quick. The anti-kickback statute, you want to develop solid anti-kickback policies and procedures that clearly outline, among other things, what type of gifts and dollar limits for gifts that are permissible. And I want to remind you again of what the penalties are. So that's down here in red is the potential 5-year imprisonment, $25,000 criminal fines, $50,000 administrative exclusion, or if you're lucky, corporate integrity agreement. Discrimination, again, we talked about the Mero Group situation where there was an allegation of discrimination, and here you want to make sure that you're having policies and procedures in place, that you're having oversight to make sure that your practices cannot even be interpreted to be discrimination. Again, big penalties, a Mero Group's case to $225 million plus the corporate integrity agreement. Our monitoring and oversight, you want to ensure that required activity is performed, and this just outlines some of the activity that you want to make sure you're watching. These are required activities. Like I mentioned, scope of appointment is required for face-to-face if you're doing a Medicare line of products. You want to also make sure you're monitoring for prohibited activities. And the prohibited activities vary depending upon what kind of activity the agent is engaged in, whether it's a sales activity, whether or not there's an educational activity, provider marketing. And this provider marketing, for those of you who might be in the pharmaceutical area, most of your reps are not going to be engaged in the marketing activity and the events related to individuals, but it's going to be around provider marketing, making sure that there's no gifts offered in exchange for referrals, or encouraging providers to steer patients in a certain way. Tip number 4 is around monitoring and tracking agent appointment and licensing. You want to review licensing and appointments on a quarterly basis at a minimum. You want to document the status of licensing appointments and track renewal dates for licensing. And this here is a screen of showing a review process. And the reviews, it just gives you a sense of how you can track information around an agent and looking at whether or not they were timely at events, whether or not they had the proper materials, whether or not they were professional. And there's also a section that deals with corrective actions. And again, the full presentation on Conform will give you more information around that. Tip number 5 is about documentation. It's one thing to say that you're checking to make sure reps are licensed and that they complete training, but you want to have documentation that you check. So keeping copies of their certifications on file. Any complaints related to documentation related to complaints, you want to be able to keep that, and documentation that you are monitoring. And again, the platform of Conform also provides an evidence room where you can be able to house that type of documentation. Okay. I talked a lot about, throughout the presentation, a lot about Conform, but Conform Compliance, we offer a number of consulting services around facility privacy assessments, developing policies and procedures, initial and annual computer-based training and live staff training, and compliance pre-audits. And the other thing that Conform offers is the turnkey and custom healthcare compliance software platform. And so I'm going to actually turn this over to Paul and let Paul tell you a little bit more about the Conform platform.
I just wanted to get a chance to share with you a little bit about our main product, which is Conform Compliance, a software tool that we use to help our clients build winning compliance plans. And the big question you might ask is, well, why use Conform Compliance? And I can show you a bunch of great slides and things on our website I have here in front of you, but I think a really easy, simple way to think of it is that Conform Compliance is kind of a good metaphor for Conform is mom. Conform knows the rules just like your mom. Conform keeps track of everyone, and when you need to show that you've got proof of compliance, you just ask Conform, just like you'd ask your mom. And so what I mean by that is that Conform is the place to keep all the rules, the laws, the regulations, as well as the internal policies. And then the compliance team uses Conform to notify everybody about those rules, the managers, of new rules and changes. And then the managers use Conform to indicate whether they're compliant or to document a plan to comply for a new rule. So then from there, when data, we have all kinds of data that we gather in the compliance process, as many of you are aware, the spreadsheets that sit on hard drives in various departments. Maybe SharePoint is part of your equation. And in our world, Conform is the place to store all of the reports, attestations, reviews, or documents that prove your compliance. And with all of this information conveniently located in Conform, it's also linked back to the rules that allow you to report on it and make sure that you can report your compliance. And so finally then, Conform is powered by Salesforce.com. When it's time to capture, report, and find any of this great data, we use the most innovative cloud computing platform in the world, Salesforce.com. And the reason we do that is because it allows us to develop and customize compliance tools for our clients 5 times faster than other systems. Using Salesforce, we can be 80% compliance and 20% technology rather than the reverse. And most importantly, Conform is part of your CRM system, which means it is where the action is, not on the sidelines. So now I'd like to take just a couple minutes and give you a quick flyover of Conform, not really a demo, and invite you, if you're interested, to reach out to us for a full demonstration of the software. It'll take about an hour to give you a good chance to see the entire application. But for those of you who are familiar with Salesforce.com, this will look very familiar to you. This is a demonstration organization for a company called Cirrus, and it's a full organization this deployment is a full CRM. So we have the sales and marketing applications, as well as customer service, call center. All of the features are built into this demonstration org so that we can demonstrate how Conform can tie into any part of your organization, from call center to sales to marketing to operations. As you can see up across the top, we have a series of different what we call tabs, and I'll just highlight a few of the key ones. The accounts and contacts. Contacts will represent the individuals that we're tracking compliance on. In the case of license agents, we would maintain their training, licenses, and producer appointment data in the database. This would allow us to actually tie back to the national registry as well and ensure that our data is up to date. Most importantly, this data will allow us to create workflow rules that will not let an agent write business without proper authorization. In terms of more traditional kind of compliance part of Conform, we have a database called Rules, which allows us to maintain the rules and regulations and policies and procedures of your company. Evaluations, which we use to evaluate the status of compliance, whether you're in compliance or need to fill gaps. Proof is the object that we use to store documentation or evidence of any kind of compliance that we have for any specific rule. And we can store all kinds of documents on the platform with no need for additional servers or software. And reviews is finally the last piece of the equation, which allows us to create customized review programs for agents, call center staff, anyone really, and use a review process that allows us to automatically report on their performance. And lastly, before we conclude, I'd like to show you the dashboard of our current quarter review. So this is a dashboard that shows the results of the reviews that have been undertaken on 3 of our agents here, and it slices and dices those into a wide variety of different characteristics, whether they're compliant, satisfactory, or unsatisfactory reviews, the type of reviews that we created, whether they were follow-up, quality reviews, secret shops, and so forth. And as you can see, when you click through using the Salesforce interface, you click through from the dashboard, and you go right to a report, which then lets you drive right through to the actual detailed records that support those reports and continue your investigation and compliance. Anyway, that is just a tiny taste of Conform, but I certainly hope that some of you would like to see more, and we'd be very happy to get the chance to do that. So I'd like to thank everyone for joining us, and please invite you to send any questions or reach out to us for anything that we might be able to do. We'd be happy to do this presentation for other groups if anybody would like to have us do so.